Hello, everybody, and welcome to the Tuesday edition of Video Clips. And first of all, I have something kind of sad to share with you. My little friend Schroeder died on Saturday in his mommy's arms on his 19th birthday. I had a feeling that Mr. Schroeder was sticking around until his 19th birthday, and that's exactly what he did. He's always was a very strong-willed cat. So I really appreciate all the wonderful thoughts and sentiments that you're sending to me. And it's sad, but he had a great life and he gave me a great life for 19, almost 19 years. He moved into the house when he was 5 months old. He took over the house when he was 5 months old, and he ruled the house until the last day of his life. Okay, so a couple of announcements, and then of course I have information to share with you. The first thing is fall semester starts in a couple weeks. And so if you are a health professional who is looking to change the direction of your career, you don't want to work in a typical practice or a healthcare institution, we have some great programs, wide variety of price ranges and skill sets, all right? If you are not a health professional and you have thought to yourself, gosh, I would like to find some way to get into the healthcare field because there's a need for more people talking about diet and lifestyle change and helping people improve their lives with exercise and diet and that sort of thing. Please send me an email at pampopper@msn.com. I am happy to send you information and also to schedule one-on-one appointments with you. When it gets close to each semester, I set aside a lot of time to do this because I think it's really, really important. The last thing is that if you are a member of Wellness Forum and you have not yet participated in one of our member orientation programs, please do get in touch with me and let me sign you up for one. We schedule them, a couple of them every month, and we go through all the benefits, make sure you know how to get into the passcode protected sites and take advantage of your membership. And you can earn points toward courses. We'll give you certificates that you can accumulate. We pay you to learn. It's called Learn and Earn, that you can apply toward taking courses that you want to take. So if you're a member, you haven't participated in one of these, send me an email at pampopper@msn.com and I will be happy to sign you up for one of those sessions and teach you how to take advantage of membership benefits. All right, so the topic today is the real story about bone health. And there's a lot to this that you need to know, but I'm just going to cover one aspect of it. So to start at the beginning, according to the American Association of Obstetricians and Gynecologists, all women aged 65 and older should have a bone mineral density test. Women under the age of 65 who are past menopause and who have certain risk factors for osteoporosis, and those would include like rheumatoid arthritis, smoking, alcoholism, hip fracture in a parent, or body weight less than 127 pounds, should also have a bone mineral density test. And by the way, I would qualify for that because I weigh less than 127 pounds. The recommended test is DEXA scan, and medications are recommended to prevent fractures if the DEXA scan shows loss of bone mineral content. Women are told that fractures are caused by osteoporosis, that the risk of fracture can be determined by screening with DEXA, and that if they have lost bone mineral density, or BMD, drugs are effective for preventing fractures. So the problem is none of those things are true, all right? A large population-based study of women aged 65 and older showed that 85% of low trauma fractures were not due to osteoporosis. Most fractures do result from falling, but even weak bones can remain intact after a fall. Furthermore, bone mineral density has been shown to be a very poor predictor of fracture risk. Aging is the cause of increased fracture risk, with one study showing a 13-fold increased risk from 60 to 80 years of age in both men and women, while bone mineral density accounts for only a 2-fold increase in risk. A Swedish study showed a very similar result. The impact of age was 11-fold greater than the impact of bone mineral density. The real issue appears to be age-related decline in balance and stability. And the higher incidence of fracture in women as compared to men is most likely due to a higher risk of falling rather than low bone mineral density. Women generally live longer than men, which accounts for the higher fracture rate in women. But even so, only 5% of falls results in fracture and only 1% in hip fracture. And hip fracture is supposed to be life-ending episode, and some studies show that that's the case and other studies do not. DEXA has been shown to have very little predictive value for fracture. Fewer than 1 in 3 hip fractures, for example, can be attributed to osteoporosis as defined by bone mineral density that's identified by DEXA. Drugs are commonly prescribed in response to DEXA scans. First, and I'll just point this out, if the entire hypothesis concerning the cause of fractures is false, then treatment based on this false hypothesis can't possibly work. And the drugs have serious side effects. I mean, I don't recommend them for anybody, and they actually cause the thing they're supposed to prevent, which is more fracture. Also, randomized controlled trials reporting any benefits of the drug approach to preventing fractures are generally not very high quality. And even some of the authors of these studies acknowledge that estimates of benefit are likely to be inflated due to inadequate follow-up and issues concerning selection criteria for the studies themselves. According to one research group, I'm going to read this little paragraph to you because I think it is really important. The prevailing pharmacological fracture prevention strategy is conceptually appealing because it's relatively simple. However, key facts about hip fracture patients should be noted. They are generally old, meaning around 80 years of age, and undeniably frail. Regrettably, bone-targeted pharmacotherapy has at best minimal effect on the incidence of fractures and on fracture-related mortality, and is associated with adverse effects. Unnecessary labeling of asymptomatic individuals also has adverse consequences, and the strategy squanders limited healthcare resources. The article goes on to conclude, given all this, should osteoporosis be added to a long list of diagnoses for which doing less or even nothing is better than our contemporary practice? End of quote. Well, I'm not a fan of doing nothing. So the 3 things I think you need to pay the most attention to for preserving bone health and avoiding fractures is, first of all, physical fitness. Most falls in elderly people can be avoided by building and maintaining balance, coordination, and strength. And I think one of the things most people aspire to do is to be able to live in their own home as long as possible, and perhaps for their whole life. You have to have balance, strength, and coordination in order to do that. So physical activity is very important. Diet. A plant-based diet provides the nutrients needed to build strong bones and has an acid-alkaline balance that does not drain bone-building nutrients from the bones, right? And then sunshine. Sun exposure stimulates the production of vitamin D, and adequate levels are required for bone health. But I'm going to give you this caveat. Very few studies show any benefit at all from taking vitamin D supplements for bone health, and many of those are of very poor quality. So I would say skip the vitamin D supplements and get yourself out in the sun. You should have a tan like I do by this time in the summer. So this is just one more situation in which what everybody knows is the cause of fractures and that sort of thing, almost like it's an inevitable thing, and you need to have DEXA scans and take supplements and take drugs, and all of that's ridiculous. You need to be physically fit, to eat a good diet, to be normal weight, strong, build your health. Build your health, and that builds your bones. They're not divorced from one another, okay? Well, as usual, pass this on to anybody who you think would enjoy watching it, and I will be back to you tomorrow with more news.